When responding to the need of CPR in an infant during the scene safety and assessment period, first, ensure that the scene is safe. Tap the bottom of the infant's foot to check for responsiveness. Shout out for help. Help! Help! Someone help! If someone responds to your call for help, instruct them to phone 911. You, phone 911. Get an AED. If you are alone and have a cell phone, phone 911 and put the phone on speaker. Answer all of the dispatcher's questions. Check the infant for breathing. If the infant is not breathing and unresponsive, begin CPR. If you are alone and don't have a cell phone, and the infant is unresponsive and not breathing, begin CPR immediately. After 5 sets of compressions and breaths, take the infant with you to phone 911 and get an AED. There are differences in how you provide CPR to infants versus CPR to children and adults. For infants, when giving compressions, you can use either 2 fingers of one hand or 2 thumbs, as opposed to 2 hands or 1 hand for a child and 2 hands for an adult. When giving compressions to an infant, your compression depth should be at least 1.5 inches versus that of at least 2 inches for an adult and approximately 2 inches for a child. When giving compressions to an infant is considered anyone less than 1 year old. When giving breaths, you may use a barrier device or a pocket mask with a one-way valve. A barrier device or pocket mask may be used to reduce the risk of infection. Performing high-quality CPR involves 2 main skills: providing compressions and giving breaths. Compressions are given at a rate of 100 to 120 compressions per minute. When giving compressions to an infant, your compression depth should be at least 1.5 inches. You should push hard and fast when giving your compressions, and you should allow the chest to rise back to its natural resting position after each compression. After giving 30 compressions, you should pause for no more than 10 seconds to give 2 breaths. You'll know that your breaths are effective if you see the chest rise. You should allow the chest to fall back to its natural resting position in between each breath.